Hi, my name is Kristen and I'm a registered physiotherapist. Welcome to this foam rolling movement practice for the lower body. This movement practice was designed to release muscular tension and rehydrate connective tissue and fascia. You'll want to choose a soft foam roll, something that is firm but has a bit of give when you try to bend it and squish it. We choose the softer foam roll so that it gets into the muscles a little bit more effectively without smashing into them. And it can help to not activate a pain response and circulate some of the lymphatic fluids to rehydrate the tissue. You'll want to do the foam rolling against snug fitting clothing or bare skin. If you find that the foam roll is still too firm, you can make a modification and choose a soft air-filled ball. We'll be doing the lower body today, and so take your time, make any modifications as needed, and rest as needed. Please use your best judgment. We'll be starting at the lower half, working our way up, and then back down. Starting with our calves. Placing the foam roll, placing your leg on the foam roll so it's just above the ankle. You'll be leaning back on your hands and have your knee bent. If you straighten your knee and then bend your knee, you can start that rolling process. And if you can, try to turn the foot in as you roll and then turn the foot back up as you come back. That helps to get that lymphatic flow circulating. If you're able to press through your arms, you'll notice you'll move around on your mat and everything. If you can press through your arms, then let your leg be heavy on the roll. Let yourself slide down so the roll moves up towards your knee. Turn the toes to the ceiling and pull yourself back with your arms. Push with your bent leg. Roll the foot in and come down, turn the toes up and come back. Making sure you're breathing throughout the whole thing. Breathing in and out. Breathing in and out. You want to do about 5 or 6 passes here. And if you feel any particular spots that are feeling like a really good spot to work into, you can kind of just pause over that spot, work into it a little bit more, or just hold some pressure on that spot and move your ankle around it. Going into our hamstring now, the back of the thigh. We'll bring the roll to above the knee, so we're not rolling across the space of the knee, it's above the knee. Again, with your arms, if you're able to maneuver with your arms, you're going to turn the toe in, push downward with your arms so that you roll the roll towards your hip, turn the toes up, and then slide back. Breathing in as you roll down, breathing out as you come back up. Again, 5 or 6 passes. If you feel a spot that you really want to work into, you can nudge up against it and work into that a little bit more. And if you're used to a more intense feeling, I do encourage you to try the softer foam roll because you can actually get a lot of release that is surprising. And so if you notice your flexibility, your movement, your alignment before and after, you can compare that and see your results. One more pass for me. Okay. Going now onto the other side, same thing. Ankle resting on the roll. If you want to maneuver through your knee, straightening and bending, you can start with that. My knee is bent, turning the toes in as I slide the roll towards my knee, and then turn the toes up as I bend it back. And the roll may creep up towards your knee as you do that. If you are able to maneuver through your arms, again, start the roll just above your ankle, turn the toes in, Breathe in, slide down towards the knee. Turn your toes up and slide on back. Breathe in as your toes turn in as you slide down, and breathe out, come on back. Again, 5 or 6 passes. And if you feel any spots that you want to work into a little bit more, you can roll, nudging into it. You can wiggle into it with moving across that area, or you can move through the ankle, bending and straightening, lengthening that calf against that tender point. Bringing the roll up towards the back of the thigh, the hamstring. Again, it's just above your knee. Turn your toes in, push with your arms, roll towards the back of your hip, and then roll back towards your knee. Make sure you're not crossing the knee. Breathe in, slide down, and breathe out, slide back. Again, 5 or 6 passes. Choosing a softer ball if you find the roll is still too much. And if you feel like a spot you really want to work into, you can wiggle across that spot. Good job. Now working in towards the inner thighs, moving to lying on your side. Letting yourself rest, letting your top leg come onto the roll, straightening out that leg, and angling the roll so that it is a 90-degree angle towards the leg. You can just let yourself roll forward and roll back, lying on your side, and then go to lying towards your stomach, letting your weight rest on your hand, and then push back with your hand. Breathing in and breathing out. If you want to get into that spot a little bit more, and maybe it's too difficult to do some rolling, you can do some movement of your knee against a tender spot, or some movement through your hip, lifting and lowering the foot. The hip will rotate in and out. You can always adjust and work a little higher, or you can come up onto your elbows and then roll a little bit further towards your stomach, rolling out that inner thigh. Now to get the space that is at the upper inner thigh, you can bend your knee up a little bit. So you find that upper inner thigh, and just from your elbows, shifting yourself side to side, working that upper inner thigh. Nice and slow. Use your breath to keep everything nice and calm and slow you down. Good job. We'll switch sides. Lying on your side. Again, you can let that top leg rest on the roll, angle it so that it's at a 90-degree angle, keeping that knee straight. You can be right on your side and just roll towards your stomach. And push back with that arm, so that this is very easy for the rest of your body. We don't want to strain the rest of the body trying to help out another area. If you'd rather, you can come up onto your elbows to do that. And if you find it's too difficult to do the rolling, you could find a spot that's a little bit tender and just work into it a little bit, again, with that knee bending and straightening. Maybe that's enough, or maybe you're using a ball. Or the foot lifting and lowering, letting the hip rotate against that tender spot to work into it a little bit more. And then we'll do another pass or two. Working into that upper inner thigh, maybe bringing your knee up a little bit more as comfortable, finding an angle so that, again, it's perpendicular. It's a 90-degree angle towards your thigh. And shifting yourself side to side, working that upper inner thigh. Good, and just pausing for a second, and then coming off the roll. We've done the backs of our legs and the inner thighs. We're going to work towards the backs of the hips and outer thighs. Sitting on your roll. You may find it's okay to work into those ischial tuberosities where the hamstrings attach. Bring your feet out a little bit more. You just start to move and roll across some of those glute muscles that attach along your tailbone. That triangular shaped bone, your sacrum in the back. Again, if it's too much pressure, you don't have to do this. You can skip this one. Getting into one side, you're going to straighten out one leg and lean towards that side. And then just using your arm and your bent knee, working into that back pocket. Breathing in and out for each pass. And we're looking for at least 5 or 6 passes. And once you're comfortable, you can maybe even work into a little bit of kind of circling where you lean a little bit forward and lean a little bit back. So you're not just going over the same area, you're getting a little bit more of a circular oval type of shape. Good. Moving into more onto your side, maybe adjust. Let the roll come to the space at the side of the hip, above the greater trochanter and below the crest of the hip. You can keep that bent knee either back or in front, whatever seems easier for you to maneuver. Letting that straight leg be heavy on the roll and rolling up and down that area. If it feels too difficult to roll, again, you can maybe turn yourself back and forth, working into the tissue that way instead. And adding a couple more passes if you're able to. Now we'll get into the famous IT band. So we want to bring the roll below the greater trochanter. We're going to work the middle third. So if you think about the whole upper thigh is in thirds, we just did the upper third. We're going to do the middle third now. Same position, just rolling up and down that IT band. Nice and slowly. If you can kind of roll a little bit, lean a bit forward and then lean a bit back. We're just doing a short area, a small area. That's easier for the rest of our body. And then we'll move the roll towards the bottom third and do that space closer towards the knee. Again, we don't have to move our whole body a lot. We'll just move the roller and do small passes. Okay. Now we'll move into the front pocket, that TFL, the kind of top of that IT band. And you can adjust the roll to that space. And then let your top knee come forward. And then levering with your knee that's forward in your arms, letting that leg get resting against the roll, stay heavy and relaxed. Again, 5 or 6 passes, wiggling into it if you feel like that's easier. 1 or 2 more passes if you do a wiggle. And then we'll go on to the other side. So on your other side, we'll start by sitting on the roll, leaning towards that side of the straight leg, and working the back pocket, that space that's right beside the tailbone. Breathing in and out every time you pass. And you can add a little bit of rolling forward, rolling back, leaning forward, leaning back once you feel like you're coordinated enough with this. Breathing in and out. If you feel like you want to wiggle into one spot, you can. Or you could even just move through the leg, rotating the hip. Or wiggling back and forth. And then trying a couple more passes if you're able. Good job. Coming down onto your side, that space at the upper third of your hip, below the crest of your hip and above that greater trochanter, the boniest part at the side of your hip. And you can start to move across that area with your arms and leg. Driving that movement, keeping that leg against the roller nice and relaxed. Breathing in and out with each pass. And again, if you can skip this area if it's too tender, or you can just wiggle into it. And another pass or two. Moving the roll down to that upper part of the IT band below the greater trochanter. Just move the roll there. I'm going to put my top foot in front. That's going to help me lever a bit more. Working that middle third of the outer thigh. Might be a little bit more tender. And on a hard foam roll, sometimes that's nearly impossible to do, but a softer foam roll makes it much more accessible. And again, if this is the soft foam roll still too much, you can always use a soft ball or a handheld type of roller. If you want, you can finish off by moving the roll down a little bit more and working that lower part of the IT band. Again, there's a bit of work here for the upper body, and if it's not accessible for you, don't force yourself. Just take a break. You still get a lot by just doing the upper part. Okay, bringing that roll to that front part of the hip, that's TFL, that lives at the front side of the hip, letting your knee fall to the floor, and then just levering through your arm and your leg that's bent. The straight leg against the roll just is nice and heavy and slides. Good. Okay. Now we can move into working the fronts of our thighs, our quadricep muscles. So again, if you're comfortable being on your elbows, you can place the roll so that when you come onto your elbows, it hits the front of your thighs. And moving through maybe your toes are helping push and your elbows are helping pull, working through both front of the thighs. And again, just working a small space at a time. Adjusting the roll towards the knees if you need to get into those areas as well. And if it's just too difficult, then just take a break. You may start with just doing the first few exercises and building up. You may find that there's some areas that really need the work more than others, so spend your time on those. And just to be complete, to offer all the muscles of the legs, let's do the front of the shins. If you come onto the roll so that the roll is kind of towards the ankles, and then using your hands, finding your balance, rolling across the shins. That can be really nice if you've got stiff ankles or those shin splints from getting your walking going. Again, some short passes, and then adjusting yourself on the roller and doing some other little passes. Again, if you can't maneuver this with on the roll, you can always use a handheld massager. Okay. And we're done. We've done all the muscles of the lower body, those main muscles of the lower body. And it would be really good if you could notice any movement or any sense of alignment, any sense of your posture, a forward bend, or how a walk feels before you do your rolling and then after you do your rolling, so you can really assess how that's working for you, if it's giving you the benefit that you need with improving some of your stretches or improving some of your alignment or posture or movement, and then also assessing whether it's too much and you need to make any adjustments if it's uncomfortable after your practice. Thanks for joining me.